This is a place with a story. A story of decisions in the past that echo into the present. People around here say it's haunted. They say you can still hear the voices, warning us.
I'm Joe Pohrer. This is the site of the former Central State Hospital for the Insane. The grounds are now home to a museum. All that's left of the hospital are a few old buildings, a plaque, a graveyard, and the story. And a story that tells us a lot about where we are now.
The story begins between 1850 and 1900, when hospitals like Central State were built all over the country to treat mental illness. By 1955, there were more than 500,000 secure mental health beds in the country. The population at that time was 164 million, so that's 341 beds for every 100,000 people. Then, we began a nationwide initiative called deinstitutionalization. The Community Mental Health Act of 1963 set the crisis in motion.
Government agencies began closing these hospitals. They believed that communities could do a better job of caring for the mentally ill patients. One by one, most of these facilities disappeared.
We went from 341 secure beds per 100,000 people in 1955 to only 14 beds per 100,000 people in 2010. In 1955, there were more than 500,000 mentally ill patients in the nation's public psychiatric hospitals. By 1994, this number had been reduced to 71,619.
So what happened to the mentally ill patients after they were released into our communities? Many were released without care, without friends, without family, nowhere to go. And many wound up living on our streets, homeless in our communities.
In 1950, the estimated unhoused population was around 100,000, mostly older men in the Skid Row sections of the 41 biggest cities. The homeless population peaked in 2006 with more than 700,000 unhoused people on a given day in America. Some temporary, some chronically, and by then it was men, women, and children. Much of it still concentrated in metropolitan areas. But make no mistake, it's a critical crisis across the country, from our largest cities to our smallest towns.
We need to understand that many good people are trying to do something about this crisis, but too many discussions focus on ideologies and politics, when what we really need are solutions. And studies have shown there are two main reasons people become homeless.
According to a study by UCLA, 78% of the homeless population have some kind of mental disorder, and 75% suffer from drug addiction.
The crisis of homelessness in America has inflamed two more problems that burn out of control across the country: crime and the incarceration of mentally ill people in our jails and prisons.
A San Francisco Department of Public Health study called it the perilous trifecta: being homeless, mentally ill, and addicted.
And there's another crisis that we're not supposed to talk about, but it's well documented in the San Francisco study and others. The homeless commit crimes at 100 times the rate of the average citizen.
The mentally ill, homeless, and addicted in many cases wind up incarcerated in our jails and prisons, where the mentally ill have higher rates of recidivism and suicide than all other inmate populations. Over the past 20 years, the number of mentally ill inmates who commit suicide has increased from 19% to 38%. Recidivism rates are just as shocking. 54% reincarceration for people with severe mental illness, 66% for those with substance abuse problems, 68% for those with co-occurring mental illness and substance abuse problems.
My family's built correctional facilities since 1856, for 5 generations. I was born to this business. Jails and prisons are an essential service to our society. Always have been, they always will be. But jails and prisons are not the place for the mentally ill. They need treatment, not incarceration.
Up to 64% of jail inmates and 54% of prison inmates have some kind of diagnosable mental illness. Studies estimate the number of dangerously mentally ill patients, people with schizophrenia, manic depression, and bipolar disease, at 20 to 25% and higher in our big cities. And there are proven treatments and therapies for all these diseases. But our jails and prisons are not equipped to provide them.
Some people say there's no solution, that will never make a difference. But I've been in the correctional industry and detention facility business all my professional life, and I disagree. I'm not alone either. Nationally recognized experts are saying the same things.
We can design and build facilities that are suitable to treating mental illness. We can repurpose abandoned buildings like schools and hotels to house mentally ill patients. We can control lighting and sound, furniture and fixtures. These innovations have been proven to help. We can improve communication and rehabilitation. We can build facilities that will make a difference. We can design a new kind of correctional facility for the mentally ill, because that's exactly what we need.
No one doubts the compassion of the organizations working to solve the crisis of homelessness and the travesty of incarcerating mentally ill people in our jails and prisons. But it's time we measure compassion by outcomes, not intention. It's time we face this crisis. We have to. What we're doing now is not working, and it's not fair. It's not fair to the mentally ill to keep them in this downward spiral of homelessness, crime, and addiction. It's not fair to the law enforcement professionals in our jails and prisons. They're not trained or equipped to deal with them. And it's not fair to our communities. Join us. It's time for solutions.